Dr. Levine, I have a question concerning hospitals, and especially in rural districts like my own. Something that we've noticed, and I think possibly going on statewide, is an issue where we have patients who are being seen in hospitals, they're being treated in hospitals, and at the end of their treatment, they're really not able to live on their own or really to be released, but also there's not much more that the hospital can do. There seems to be that in-between stage for hospitals. Is that an issue that we're seeing in terms of patients that are maybe through behavioral health, or that they've been treated, they've been cared for, but no longer will the hospitals, be reimbursed, but there's also nowhere to go? Is that a situation that is statewide? And if so, are there any conversations about ways that we could possibly address that?
Sure. So I think that is an issue statewide. I think that you'll find that hospitals, since for the most part they're paid by DRGs in terms of the diagnosis, are trying to get people better and to discharge them more quickly. I think that's a general rule in hospitals and throughout the state, and I think it's more a challenge in rural areas because of lack of other care. I think that other types of facilities are being looked at to take care of those patients, such as rehabilitation hospitals. So you can have rehabilitation for orthopedic issues, but you can have or rehab hospitals that will take care of cardiac patients, cancer patients, etc. And then also we have an expanding home health industry, and so we regulate all of that. And I think that the goal is that patients would be sent home, but then also with home health care or rehab. I think it's a particular challenge in rural areas because there might not be as many home health agencies in rural areas as there might be in suburban or rural urban areas, and also in terms of the number of rehab facilities. But I think that the idea is to go from acute care to subacute care, whether that's in rehab or at home.
And I'll only add to that it's not only the agencies that are limited, but it's the direct care workers themselves, the individuals who work at those agencies. We have a direct care worker shortage here in Pennsylvania. The Department of Aging, as well as Health, have participated in putting out some ideas around how to address that shortage, but it's the challenge of having the employees, particularly in rural areas, who can provide that care in the communities.
And one more point is that one of the reasons why we have a dearth of direct care workers is that they don't get paid well. And sometimes they get paid at a minimum wage. So one way to improve that would actually be the governor's proposal to increase the minimum wage to a living wage, and that would actually help more people become direct care workers, because then they could support their families.
What about within the hospitals themselves? I mean, are we finding that they are short-staffed? Are they healthily staffed? I mean, as I look at it, there certainly are options for continued, home care and skilled workers there. But also, if some of these individuals are already in the facility, if hospitals can also expand a little bit of what they can do. I mean, are they capable of that? And it's just a matter of whether they're getting reimbursed for it or not?
I think one of the issues that this relates to is rural health hospitals, rural hospitals in general. Rural hospitals are under siege throughout the country and in Pennsylvania because it's very hard for them to survive in that fee-for-service environment. And so that is really the basis of our rural hospital initiative. And thank you for the legislature, and thank all of you for unanimously passing the Rural Health Redesign Center. So this is a very innovative program. It was actually the brainchild of my predecessor, Dr. Karen Murphy, to save rural hospitals so they no longer have to live on a fee-for-service basis, and they'll work on a global budget, which would help them be able to take care of people without having to worry that they're going to have a large deficit and then eventually have to close. I mean, we've even seen some hospitals close in the last couple months that are rural hospitals. So we have this initiative. The Rural Health Redesign Center will be up and running by May.
So with that being said, real quick, with with that initiative, I mean, you just said we've seen some hospital close. Do you feel that it's just the initiative didn't have time to work, or was it simply those were going to close anyway? I mean, is there more that we can do there?
Well, the goal is to expand the initiative. It's been running 1 year, and we had 5 hospitals. We recruited 8 more, so now there's 13 hospitals. The goal is 30 hospitals. We would love your participation in terms of recruiting hospitals to the model. It takes a real leap.
Well, you have mine, so that's
Thank you.
good.
It takes a real leap to go from the traditional fee-for-service to a global budget, and we'd love to work with you on recruiting more hospitals.
Thank you. Thank you, Mr. Chairman.